Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is Acanthosis nigricans. So what is Acanthosis nigricans? This is epidermal proliferation due to stimulation of keratinocyte insulin-like growth factor or IGF-1 receptor. Acanthosis nigricans can be classified into 3 different types. These are benign, pseudo-acanthosis nigricans, and malignant form. The benign form can be inherited or drug-induced, and an example of this is secondary to the combined oral contraceptive pill. It can also be associated with various insulin-resistant syndromes. The pseudo-acanthosis nigricans is associated with obesity and more common in darker skin. And thirdly, the malignant form is associated with adenocarcinomas. Acanthosis nigricans comprises thickened, pigmented papillomatous skin with velvety texture. It commonly affects the axilla, neck, and groin. Mucous membrane involvement is common in around 50% of people with acanthosis nigricans. Palmar involvement, or tripe palms, are usually seen in the malignant form. And here we have a picture of an example of acanthosis nigricans affecting the axilla. In order to investigate a potential case of acanthosis nigricans, as with all dermatological conditions, history and examination are key, and this is in fact a clinical diagnosis. Blood tests can be important, particularly when investigating for possible diabetes and insulin resistance. Biopsy is only necessary if there is diagnostic uncertainty. It is of course really important to screen for potential underlying malignancies in this condition. Treatment of acanthosis nigricans is varied depending on the type. So pseudo-acanthosis nigricans will improve with weight loss. Drug-induced forms will improve when the drug is stopped, and treatment of the underlying cancer will improve the malignant form. Now for a question. So a 40-year-old Indian lady presents to her GP with a 2-month history of worsening hyperpigmented, thickened, velvety skin over the back of her neck and armpit. She has been found to have a HbA1c of 60. What is the likely dermatological diagnosis? So our options are eczema, psoriasis, lichen planus, acanthosis nigricans, or melasma. And so you'll recall from this presentation that acanthosis nigricans is the most likely answer in this case. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.